department at Seoul National University. Okay, how are you doing today?
I'm doing really great. It's wonderful to be here. Thank you all for inviting me. I want to just start by offering my congratulations on the 8th Chosun Biz Healthcare Forum. I mean, I think events like this are necessary and a way that we can enlighten the opportunity for the healthcare sector to move forward to do the best for people's health. It's a major forum that's going to help the industry not only think about navigating the COVID pandemic, but how we're going to build a better world beyond. So it's a great joy to take part in this today and to contribute to this yearly event.
Great. Today, I'll be asking a few questions. I hope we get to know about each other better during the interview. Let's get started with a brief self-introduction or highlights of your career.
Well, thank you, Dr. Park, for your interest. It's been a really great career. I've had the chance to be a doctor and take care of patients in the hospital and the clinic, and to teach the next generation of doctors, do research. But along my career, I got pulled into public service that in some ways was to support the public health in New Orleans, where we had a big Hurricane Katrina, and I was asked to serve to help rebuild our community and to bring health and healthcare to people in the city. And since that move out of the medicine, academic medicine, and into public health, I've also served in the Obama administration in public health and as the National Coordinator for Health Information Technology. And now I've just joined Google a few months ago as the first Chief Health Officer here.
Okay, very impressive.
It's been fun, I have to say. I've been really grateful for the experiences that I've had. So thank you so much. That's really kind.
All right. Let me start with the first question. Google seems to be recently strengthening its presence in the healthcare market. For instance, I heard that your position was created only last December. Could you elaborate on why Google is now expanding into the healthcare industry? What are Google's long-term goals in the healthcare field, and what projects are you working in?
There's a lot of big questions, and so let me take them a little piece at a time. We often say here at Google that health is in our DNA. Meaning that when we think about Google as a company there to be helpful to people as they're seeking information to improve their quality of life, that helping them on their health journey is a really important part of that. That we want to help people not only as they're searching to understand, do they have diabetes, or what should they learn about diabetes or other potential illnesses, then help them take action on that journey. Find a screener that will tell them, ask them some questions to see if they're at risk for diabetes in that case, and then maybe find resources for where to go get services or care. So we have work that we believe we can help people with on this health journey in their lives. And so Google has been pulling together from across the company various research efforts and consumer-facing efforts into one unit called Google Health, and I was asked to come join the company and did so last December to stand up the clinical community, not only within Google Health, but all across the company, as we make sure that we're doing all we can to put trusted information on search and YouTube and the Play Store and wherever people go for that information, help consumers on their journey. We also have been applying the tools that we have in artificial intelligence and machine learning, an area of interest of yours, I know, to help clinicians, to give doctors and nurses and others, sometimes we say superpowers, to be able to take better care of patients, be more efficient, more effective, find that cancer in the pathology slide or on the radiology film that maybe the human eye might miss, but that computer vision would see. So our work here at Google then is really broad-facing. It's to help consumers, but also to help those they trust with their health, and that would be their doctors and their care teams.
My next question is, are there any projects Google is now pursuing as a consequence of the coronavirus situation?
There's no shortage of things that we're doing as a result of the coronavirus situation. And, we've been, as a company, focused as job one to see that we can provide the right information at the right time to people around the world about coronavirus so that they know how to protect themselves and protect their communities.
Yeah.
In public health, this is the most important thing, is communication about any crisis or any illness. And so we have a chance to put up good information in partnership with ministries of health, with the World Health Organization, and so we partner to do that on search and YouTube, on our Maps services as an example. So early on, we started that work to give consumers good information about coronavirus. We have been continuing that through the journey, but we've also been supporting medical and scientific infrastructure, so providing supports for data resources to help with predicting COVID outbreaks or predicting resource needs in the healthcare environment, helping scientists to understand protein folding to build therapeutics and vaccines, and then a lot of work with the public health community, whether that's helping them with the data resources that they might need to understand the impact of policies around things like shelter in place or social distancing, but also to help support them as they try to get information out to the community. So we have these three big audiences, really: the consumer, the medical and scientific community, and the public health community that have been our focus. Really, the interesting part of the pandemic for us has been it's accelerated the work and the relationships that we already have or had wanted to build. Consumers come to us every day to ask for information about their health. This was another type of health question they were asking. So we set up screeners about coronavirus to help people understand if they should get tested. We help them take action to get tested. We have listings of 17,000 sites in 20 countries around the world where people can go get coronavirus tests. And we also have been able to work with the medical and scientific community to help them understand their supply and resource needs. And then in the public health community, really accelerating our ability to think about context. One thing, Dr. Park, that I've learned in my journey as a doctor is that it's not just about the right medicine for the person right there in front of me, that there's a history of their exposures and their non-medical drivers of health that really matter. So sometimes we say context matters, where they live and what their environmental exposures have been. So we believe a lot in also working with public health, so we can do all we can, not only in COVID, but in other times to help support public health. So yeah, we've built up a lot of new work, but we've been using that as a way to strengthen what we want to do for the world's health, even beyond the pandemic.
I think data is very important for healthcare innovation. So, as medical data is a pretty sensitive, personal information protection can be a major issue. However, for prevention purposes during the pandemic, some degree of the data use is necessary. How does Google find the balance?
Data is some people say it's the necessary fuel for the 21st century for all of us to do what we want to do in our daily lives, in our work, and in health. But data about people is tightly connected to privacy and trust. It's one of the things that I learned very early in my medical career in taking care of patients, is that they have to trust you. They have to trust you with the information about their health and their lives so that you can be a part of their health journey, and they'll tell you the things that are important for you to understand to get them the right treatment and to help them make the decision. So trust is sort of foundational, not sort of, it is foundational to the way I want to work and how we want to make sure that consumers can learn to trust us also. It's one of the things that I really respect and admire about Google. I've learned more about it since I've been here, about how important it is to us that we're being respectful of consumers' data. And I'll give you a couple of examples. of how in coronavirus that's played out for us. One is in these community mobility reports. I mentioned earlier that we've provided some support to public health for them to have some evidence-based way of knowing if their policies for social distancing are being followed. And we took data that we might have used for the business environment to say, look at the busyness of a restaurant, and we're able to apply that to a public health use case. And in this situation specifically for COVID-19, to see if there's less dense population in retail or transportation or parks or workplaces, and to give the public health community a sense of those changes. But that data that we use is anonymized. We're very careful about how granular or how small of an area of analysis that we put out so that it's not easy to identify. We don't list the number of people that are collecting in an area or gathering in an area. We rather use a percent change to try to protect the privacy of people in those communities. And we add some additional layers of privacy protection. So in that public health case, even though it's population level data, we went to great lengths to protect people's privacy in the local community. Very similar story in the work we've done with contact tracing. You may be aware that we've been working with Apple on a tool called exposure notifications that is designed to be a tool in the toolbox for public health in the work it does for contact tracing for coronavirus. And we were asked by the public health community to help if we had digital tools that could help them help the community know if they've been exposed. And our engineers and also the engineers at Apple saw that they could use Bluetooth Low Energy, BLE, as the pathway for helping people know if they had been near someone who had been exposed for a sufficient period of time that it would matter. 6 feet for 15 minutes would be, for example, what we are using in the U.S. context. And that tool very particularly does not use GPS or location. Rather, it uses a very anonymous, it's about the phone and it's just Bluetooth, and people opt in. It's voluntary. These are the sorts of things that we heard from consumers and communities around the world, that they wanted to have the choice to help with contact tracing, but they wanted it to be done in a privacy promoting way. So those are two examples of how the company is really working to build trust with the community and with public health and protect the privacy of the people that we're partnered with.
Okay, I have another question for you. The lack of medical staff has become a problem due to the COVID-19 pandemic. Do you think there are any ways to manage such challenges through innovation in healthcare?
Well, I think all over the world, people are rethinking many of their strategic plans, and the ways that we've been doing business in general, and healthcare is no exception. I think for us at Google Health, what we learned is that many of the ways we were thinking about building better health for people in the world was getting accelerated by COVID. And the examples would be, the way I say it is, meet people where they are. So rather than expecting your patients to come to the clinic or the hospital to see you, to use digital technology like telehealth or chatbots to have a way that you can literally meet them where they are virtually, and sometimes even asynchronously, so you're not having to be in the same space at the same time. This is not just about convenience for patients, but that's really important. It's really also about seeing that you can match capacity and demand. So if, say, for example, a community doesn't have enough psychiatrists or mental health providers, and there's need in another community, you can match those by using digital health. So we're really excited about some of the efforts we've done to help people navigate to find telehealth or digital health services. But I think in general, this is where the healthcare world really wants to begin to evolve, is to a place that it doesn't require people to stop work, to stop school to get simple care, but rather we can find other ways to augment the services that are delivered. I think the second area is You mentioned it in your prior question, Dr. Park, which is data. I think the world is just beginning to understand how, with the right privacy protection and security, that people's data can tell the story of where their health is going, not just where it's been. So this is predictive modeling. This is leveraging artificial intelligence and machine learning to kind of see over the horizon, to understand which of our patients are going to get sick in the future, or for a patient, what is their risk for cancer, and how can they take action. So I think the opportunities there are to accelerate what we've been learning even in this pandemic about how to do care remotely or asynchronously, but also how to leverage data for individuals and communities to be more preemptive in the services that we deliver and not as reactive as we've been in the healthcare system.
Wow, thank you. Thank you for your insight. My next question is, in China, there has been a case where AI was able to pass the medical licensing examination. Do you think that AI will really come to replace the human?
Well, I'll just say that in general, I hope not, because what I know about practicing medicine is that the technology is very helpful and necessary, but the humanity, the human touch, the sense of caring that we have to also give to our patients is just as important. And I think that we have to find a way to use technology like artificial intelligence to reduce some of that cognitive load for the care provider, to allow more space for humanity in the interaction. I've had thousands of patients over a 20-year career, and I can tell you that sometimes what they just need is someone to hold their hand or to pat them on the shoulder or to just look them in the eye and tell them that you're there for them. I can have more time to do that if I also then have artificial intelligence to accelerate the work. I'll give you an example of something that we are working on at Google. We've just announced some work with the Mayo Clinic where we can use artificial intelligence to improve radiotherapy. So people with cancer that need to get radiation therapy, the radiologists need to spend time marking out where the tumor is to be as specific as possible to only radiate the tumor and not the healthy tissue nearby, to reduce complications, but also to decrease the amount of time that people have to spend in the healthcare system to give them more time with family and friends and in community. And what we're hoping to be able to do is to shave hours off of the time it takes for a radiologist to do that contouring around the tumor, which just gives a radiologist, first of all, more speed, if you will, to do more reads of the films to identify how to help people who have cancer with radiotherapy. So that's more people that can get serviced. But it also then gives the teams more time to sit there and explain to the patient what's about to happen, because they're not manually doing so much work. And then finally it gives the patient and their family more time out of the hospital, because they don't have to wait so long for the therapeutics to happen. We have other examples like that, which I could share in mammography work that we're doing, or retinal imaging work. But the general idea, Dr. Park, is what we want to do at Google Health is we want to augment clinical practice. We want to give tools to the clinical team that allows them to not only use their technical skills in medicine or in nursing, but to augment that, to give them, as I said earlier, superpowers, so they have more space to also bring some more humanity back to medicine.
Oh, I also think so. I can agree more. Do you have anything else you want to say to Korea, some healthcare industry, or some Korean people?
I think what I want to say, first of all, is less related to healthcare and just more related to saying thank you for being a beacon of light and of hope in the coronavirus situation. What I understand about how you all have rallied as a community to care for one another and to think about what we would call public health hygiene, masking, distancing, hand washing, and really think about the care of others has been a wonderful model for me as a public health professional, and I'm just really impressed with how much you all have come together, but also just seeing that a conference like this can have people in person is a beacon of light for all of us here in the U.S. that we're all going to get through this, and we're going to come out on another side where the global community can work together on improving public health, but also really advancing science and technology to improve the health of people and communities. So I look forward to maybe one day visiting in person and having further conversation with you so I can learn more about the kind of work we're doing in South Korea, because I think it's all about us working collaboratively all across the globe.
Thank you for your time and insight.
Thank you.
Thank you very much.